The nightmares are the people who go drinking. You've just done your ACL or fixed their patella because it keeps dislocating. And next thing you know, they're telling you about that night. They're on top of the table. I kid you not. This is, like my room's great. It's like the confessional. People just say what they want. And I'm not judgy. I just look bewildered. They're saying they're on top of a table, they've had a few drinks and, turn around because what could go wrong? And their kneecap pops out again. It's come out 5 times and the surgeon spent 2 hours putting back together.
Hey guys, before we start this episode, a big thanks to our major sponsor for the last couple of years, Southern Slugs. Speaking of the Southern Slugs, there's a great event happening in October this year in Croatia. The Australian men's and women's teams are heading over there to take on the Croatian national teams. The tour will be headlined by the one and only Kevin Sheedy, who'll be coaching both teams. Brent Harvey and Isaac Smith, speaking of legends, well, they'll be playing for the national men's team and doing school coaching clinics as well. How good is that? 2 dates to the 7th to the 15th of October. Also available are 6 nights cruising the Croatian coast on a 5-star boat or taking the Oktoberfest in Munich, Germany. I've done that before and it's unbelievable. So it's all thanks to Aussie Rules Global taking the game to the world. Head over to the Southern Slugs Facebook page for more details. Thank you so much to our new sponsor, the Woodville Districts Basketball Club. They compete in South Australia's junior and senior basketball competitions. They're one of just 10 member clubs in Basketball SA's competitions. They provide complete pathways from 6-year-olds to seniors to state and national representation. And I happen to be their court announcer. Well, what a pleasure for the very first time to have Dr. Mark Ralfe on Legends with Bevo.
Thank you, Bevo. Thanks for having me. I think that's going to be great.
My absolute pleasure. And thank you so much to you. Obviously, you're a very busy man at the moment for obvious reasons. But before we talk about what's happening in the world of sport in terms of concussion and everything else at the moment, let's hear a bit more about your background, Ralfey, because you've certainly had a very interesting background. You've worked with the Giants at the AFL at the highest level and lots of other sporting organisations. Tell us a bit more.
I was very lucky to marry into the Williams family, so that gave me a quick intro into sports medicine. But I even started doing sports medicine as a medical student 30 years ago, stitching up rugby players in Wellington. One of the registrars I was working under, his husband was playing rugby and they wanted someone to do a bit of stitching on the sideline. So I volunteered, and since then I've always had an interest in sports medicine because really you're helping people of any age just be the best they can, try and keep active for their whole life. And it's not just elite, but the tradies, everyone else sort of, trying to work during the week. And if they get injured during the weekday, then that's a struggle for them. So trying to help the average person get back to being fit and healthy is important. And the other thing I like being a GP doing sports medicine is just that sort of bit of holistic care, as you're looking after someone's knee or shoulder, particularly blokes who don't see a GP normally. You can ask them how life is and have they had their blood pressure taken lately and just try and start that health and wellness conversation and the mental health discussion as well. So part of that, and I I got distracted there, but after I came to South Australia, my new girlfriend, Jenny Williams, kept diving off and watching her brother coach Port Adelaide Magpies. So I started helping out South Adelaide. I knew one of the guys doctors who were helping them. So that was my first year in Adelaide, was actually helping the Panthers down south. And so I thought it would be a bit of fun to stick a Panther sticker on when you sort of partners' cars. She had all these Magpie stickers over it. And so, stuck a Panthers thing, and then let it go for a week or two. And then she came in and said, "Oh, I had a bit of trouble." I said, "What's the problem, Jen?" And she said, "Oh, Bucky got me into the office at Port Adelaide and said, well, how can a Port Adelaide, stalwart have a Panthers sticker on a car?" And someone tried to break my window, and I thought, "Oh my Lord, what have I got myself in for here?" Bucky Cunningham's telling her off, and she's having threats, and so her friends backed her up. So for weeks, I was having to pay for dinners and try and cook, which I can't. I can burn water. She hit me going. So that was sort of the first indication of the depth of feeling around footy in South Australia. It was a joke, obviously, but South Adelaide was a fantastic place to start working, and after that, I helped the Magpies as their doctor in the SANFL for over 10 years. And that was a great introduction because they had a lot of senior players at that time and they knew a lot about their bodies, a lot about how to recover and how to get better. So they were teaching me. I was talking to the trainers and they were teaching me a lot, as well as the doctors and the physios. And after that, I just incorporated more and more sports medicine and through opportunity and luck, I managed to work with as the Adelaide-based doctors for the GWS Giants, which you said introduced me again to wonderful doctors and coaches and physios. I was able to work with Cricket Australia. So Terry Farquharson, who was one of the older retired sports physicians now, but he worked for Norwood, unfortunately. But he got me into the cricket. So I helped him out with the Redbacks and the women there for a while. And through those introductions, then got to work for Cricket Australia on a world tour about 10 years ago now with the under-19s. And that was a great experience. So in Sri Lanka, and then sort of went through to Dubai where the competition was. Went back to the SANFL, helped out not only them, but Jen was coaching Australian lacrosse, so helping them as well. And lately been helping out Adelaide United, looking after the away teams. So working for FFA in the Australia and the Soccer Australia. And I was lucky enough to be one of the FIFA concussion doctors in Adelaide. So that was great. So I got to sort of see how FIFA at the very top sort of deal with concussions and injuries. And sort of through there, but through the Wakefield Sports Clinic, have lucky enough again to be on a Australasian Concussion Guideline Committee through the University of Queensland, and their guidelines will be coming out the next couple of months to supplement and back up the AIS and AFL guidelines for concussion management. So, yep, happy where I am. I'm working at the Wakefield Sports Clinic doing a lot of injections for sore knees and sore hips and shoulders, everything that sort of older footballers and netballers have to carry, and looking after general sports medicine on the weekends. It's a great life.
It sounds like it. And go backward a step. Where did you actually meet Jenny? How'd that come about?
Well, she was having a break from teaching at the time. She was helping Sports Medicine Australia, South Australia, run one of their conferences. And I rang up them, just landing in South Australia, and I was pointed at them by one of the other consultants that said, you should ring up Sports Medicine Australia to hook up with doctors and physios just to sort of make contact. So I rang up Pat Sharp, who was the CEO, the general manager at the time. Got talking with her, and I met her on the Friday night up at Clare, and sitting at her table was this woman, Jenny Williams. And Pat had to sort of excuse herself fairly quickly and said, well, Jenny will look after you. And almost 25 years later, she's still looking after me. So it worked out very well.
Sounds like, so she must be the one that's doing the cooking in the house then, Ralfey.
Yeah, she is. Jenny is actually. She's a wonderful woman. She really looks after me and has taught me so much. The number of games I've been at, or carnivals and things, and sitting with Jen, because she sort of supports me doing this, and she'll, someone will come limping off and she'll go knee. I go, really? How can you tell? Yeah, it's a knee. And I go down and shoulder. Just holding their upper limb. So her being an ex-PE teacher and an athlete, she really knows her injuries. And for many, many years, it still happens. People come up to her and go, well, I've had this bad knee, Jen, what should I do? And I say, well, and hold on, I'm the doctor here, and mind you, what do I know? Because honestly, a lot of the time it is coaching. It's a practice thing. Jenny now is a sports psychologist and in business psychology, so it's worked very well when younger athletes or any athletes have had chronic injuries like ACLs or shoulder reconstructions. They actually need a bit of help getting through that mentally, and Jen's been there for them, and then she'll refer people to me who've perhaps had chronic injuries and need a bit of sorting out. So I think we're a good team. We're an effective team.
I love it. And I look forward to speaking to Jenny on the show sometime. Might be dishing a bit of dirt on you from her, perhaps. So,
oh, dirt, speaky clean.
Now we should get to the serious topic of concussion. You talked about it before with the soccer situation. With the AFL, it's such a hot topic at the moment, not only AFL men's, but AFLW as well, and all the other high contact sports, as a matter of fact. But do you think the way they're doing it at the moment with the AFL and the AFLW is actually going okay, Ralfey, or is there things that they could do better? Obviously, they're trying not to affect the fabric to the game too much, but do you feel they're doing okay at the moment?
Yeah, I think so. I mean, I'm not an AFL doctor. I'm not involved in it personally. I certainly see the community sport and its effects on them and how they're umpiring it now, and the people who are coming in, with the 21-day rule for the community. So that's a point of confusion. I think that is confusing for the public when they see 12 days for the AFL with the concussion, 11 days for NRL, and then they come into the community environment and it's a 21-day minimum period of time out. And then you get this crazy situation, the SANFL, if you get an AFL-listed contracted player, they have a 12-day break, and if you have a non-AFL contracted player, they have to have a 21-day break. So it can be a little bit confusing. The brain is a brain, concussion's concussion. It doesn't care what's code of sport you're playing. It needs a certain amount of time to get better. And that's a trend we've seen over the years, as it's gone from just a few days to a week or 2 weeks and now 3 weeks. And I don't think the timing is going to get any less. These new guidelines that are coming out still back up to 21 days. New Zealand's got a 21-day program through its rugby system. So I think we're all talking a similar time period. It's just hard to navigate or not hard, but the average person, if they see AFL's got 12 days, well, why can't I have 12 days? The AFL's lucky because they've got a doctor on site every day, and they're doing a scat sixes now every day. They're assessing them. They're getting balance training. They might be getting neck treatment from physios every day. They're getting very intense treatment. And I know that the South Australian, that all the AFL doctors and rugby doctors that I've come in contact with on the East Coast are very serious about concussion. They treat it well. They're teaching us how to teach it properly. So for that group of players, they're being treated well. But the community, because they don't have so much contact with doctors who are experienced in concussion and physios who deal with it, they do need a longer, safer time period. They talk about this buffer week now. So, it used to be 12 or 14 days, but then there's another week of being in a training environment at the club doing full contact training, just to make sure that you're cherry ripe for the weekend coming up. And there's still no blood tests. There's still no spit test. There's no gadgets that you can put on your head at the moment that have been certified and used by the international community. There are certainly things that you can do. There are things you can put on your head. There's virtual reality, eye tracking and motion sensor tracking technology that's interesting. That's what FIFA used. There's EEG, where they put little electrodes at the back of the head that you put on like a VR, again, type headset. So there are things that are looking very promising, but at the moment, all the guidelines, which we have to adhere to, don't suggest the use of any machines or blood tests or scans of any sort. It's a purely clinical diagnosis. The long answer to that short question is I think they do. You do need those video reviews at the top level. And for everyone else, if you've got the slightest hint that someone's got concussion, you come off. And it doesn't mean that everyone gets a concussion diagnosis. I saw one of the women who used to play with my daughter at St. Michael's at Smosh, and she got a ball to the face, effectively smothered a wet ball in the middle of winter with her face, and her head rocked back. She'd had a couple of concussions last year. She had a bit of neck pain, a little bit of headache, but she had a neck-related headache. She basically got a little bit of whiplash from the ball, but she was fine. Balance testing was good. Her brain was working well. She was a lawyer. During the week, she's made some good decisions. She was clear as a bell. So she didn't have concussion. So don't think if you're worried about concussion and you see a concussion doctor that you're going to be diagnosed with concussion. It's not a lay down misère. You will be assessed on your own merits, but it does take that full 21 days at least. That's a minimum.
So in terms of, like I mentioned before, like obviously they're doing their very best to maintain the fabric of the game in terms of AFL and AFLW and rugby and other high contact sports, but they've also got that concussion aspect to it as well. So do you feel as though they're doing things okay at the moment, or is there improvements that can be made?
I think as far as we can tell, they're doing it really well. The AFL doctors, Dr. Badisky and others are at the forefront of AFL medical treatment, concussion treatment and research. We have these people and others from Australia going overseas into the big international sports consensus conferences about concussion and contributing and feeding back to us about their latest information. So I don't think I've got any dollars in the game because a club's not going to employ me or sack me, or an AFL doctor's, still going to say hello to me tomorrow, I think, or not. But I'm just saying, as an outsider, they seem to be following good processes generally. And I think it is, I think a big point of contention perhaps for the AFL is whether you have an independent head injury assessment doctor like the rugby do. That's something that may change. And I haven't heard any whispers, but again, I'm not in the inner circles. So the pros and cons to that are you do have a totally independent doctor who is not under any sway of coaches or boards or anything to make an independent decision. And one of my sporting highlights of my career, I think, being a Kiwi, was actually helping out at the rugby test last year against the South Africans, the Australians versus South Africans. So the warm-up game was the Kiwi women versus the Aussies. And funnily enough, it was like it was bigger than Ben Hur, the stuff on the sideline. I think there were more doctors and nurses than players, but if you were five doctors or four doctors, like three of us were a Kiwi, so we were barracking for the Kiwis to start with, and then they were playing the South Africans afterwards. So, it was easy to barrack for the Aussies, but they had a head injury assessment doctor at that game, and he was pinned to the TV and wasn't shy about asking the officials to step in if needed, and they didn't need to that game. The cons for it are that you don't know the players as well, and you might sort of look at me and say, oh, geez, he's a bit silly and he's saying, strange things. And if you know me, that's my everyday conversational style. So that the doctors know their players and the physios know their players very well. So they would say, look, we know what they're like. If they seem slightly dazed or confused, we'll be able to pick that up quicker. But personally, I would like to see perhaps more of a rugby type HIA assessment process, but I don't know. I think the evidence is out. You got to keep coming back to, is there evidence either way? Has there been research done on, is there more HIAs picked up if there's an independent doctor versus a team-based doctor? Or is it a political move and it just feels good doing that? That's the question. I haven't seen any research around that. And I think if there is some solid research, then we should go with it.
I want to ask you as well about the difference between, say, a sport like AFL and rugby. We've seen situations recently where Petrarca got hit from behind, and obviously terrible situation there, ended up in ICU, and he's not playing for the rest of the season now. And we've had the situation years back with Tom Lonergan from Geelong. And do you think that the fact that in AFL sometimes there's contact where you're not expecting it versus, say, rugby where there's the offside rule and you can brace for that contact, do you think that's a difference as well, Ralfey?
Well, that was a huge learning curve for me, because as a growing up with rugby, not that I only played it at school playing PE, because I was going to a public school, a lot of Maori and Samoan, Tongan mates, and they would bury you. I've still got a sore shoulder trying to stop a couple of guys who weighed about 3 times as much as me when I was a skinny 15-year-old. So it looks funny as a rugby guy looking at AFL tackles and what happens to say, well, they don't look that heavy. But when you're out there and you see the types of injuries, you're exactly right. Because there's no offside rule, you can be hit from the side, you can't brace, you're on one foot quite often, or you're in the air and you can't protect yourself. You get very, very heavy collisions, and you don't need to talk very long in a tea room at any medical sports clinic. And I've certainly had injuries that have been car accident type injuries, ruptured spleens, ruptured livers, ruptured bowels, testicular injuries, brain bleeds, you name it. If you could get it on a motorbike heading towards a Stobie pole, you can get it playing any contact sport at this very high level. So, I think the hard thing with the Petrarca incident, and I only know it just from watching on the sidelines, I do not know anything more than that. But I can tell you how hard it is as a doctor when you've got the crowd screaming at you. You got a young fit guy saying they're right, they're right. The coach is, saying, look, he's one of our best players. Is he right to go? Is he right to go? And all he can do is assess him as best he can on the sideline, because quite often they won't even go, what are you going to do? So put him in an arm lock and take an otherwise fit, conscious man who says he can play, underneath and force him to have an examination. It's hard to do and hard to convince people to do that. And these young guys who are very fit, and this is talked about in adult trauma, is that they'll keep their blood pressure up. They'll be very well until they're not, and which means that all that you'll find as a sign or a symptom is their pulse rate will go up. Guess what's just happened? He's in pain and he's just come off the field running around in AFL. Of course his pulse is up. And a lot of them, if they do crack a rib, will continue to play. So it is a very hard situation for the doctors. And all I can say is I've read in the paper, like everyone has, that the AFL reviewed it and they were comfortable with the process. So the AFL doesn't employ dud doctors. They are very good at what they do. So we've just got to trust that it was a difficult decision. And as soon as it was obvious that he was unwell, they carted him off and he had received appropriate treatment.
Yeah, well said. Do you think we're getting to a stage now where, in terms of concussion, where players are going to start having to sign waivers before they sign an AFL contract? You know, they're happy to play the game knowing that there's going to be that contact. I chatted to Boomer Harvey about this a few months ago, and he said that most players love the game and would be happy to do that. Could you see that happening down the track?
No.
No?
I think that's because I had a nephew, Mark Williams's oldest son, Marcus, is a litigation lawyer, criminal lawyer, sorry, in Melbourne. And when he was doing his legal training, it was interesting. Jen, she's got more brains than I, so she was helping him with some of his projects. One of the things I think that's difficult from a legal standpoint is signing waivers to sign rights away. And his case point, which was a real case, was a four-wheel quad biking sort of farm trips, and people were, blatting all over a farm or a paddock, and occasionally someone would go over and break things or have a head injury. And I think in court, I'm not a lawyer, so there's lots of disclaimers, but it's very, very hard to defend a piece of paper that someone signs. I mean, you can think of all the ethical and emotional pressures around signing. So you say, Bevo, I'm about to give you a $5 million contract. Who knows how much you're going to earn over your AFL career, but it'll probably be millions if you're any good. All you got to do is sign this little bit of paper to say, look, you'll put up with any injuries that you get because, look, that, a bit of a shrug, that's just part of the game. Now, the managers, of course, they get a percentage of this. So I'd imagine there'd be a fair amount of pressure from the manager to be signing things. And a lot of these young men and women, they love their sport. There's so much emotion and time and passion invested in their hopeful career. I think they would almost sign anything. So it's very difficult to imagine, because the problem with the CTE stuff is it's often decades later that it comes out. So I think it would be a difficult prospect to get people to sign things and waive rights. One big issue, and I think this has got to be solved at some point, is my personal opinion again is that this is their workplace. This is their career. They get paid to work, but work cover, this is Sean Wren and a group action sort of went through this many years ago, trying to get work cover to pay for their injuries. And work cover said, we don't recognise professional sports grounds as a proper workplace as per the work cover legislation. So we're not going to cover you. Medicare have hinted in the past few years, just before COVID, that they're not going to subsidise any professional athletes potentially getting treatment if they're a member of a rich, well-resourced sporting industry. For example, AFL, Cricket Australia. Now, at the moment, that's all gone quiet. So Medicare is still supporting them, but work cover's not there, but it is their work. So then they don't have work cover backup. So then you're relying on the club to support you for the rest of your life if you have a life-threatening, limb-threatening injury or a brain injury. So I think the legal situation around work cover and the ongoing support's got to be worked out. And maybe that's where, if you are going to start signing agreements, then it's got to be some understanding it will fall under work cover. But at the moment, unless you're I think the only work cover time, there's a bit of a, there's 2 years. They'll pay for 2 years of income in work cover. And we're talking about a CTE, which will happen in 15 to 20 years' time and then affect you for the rest of your life. So that doesn't fall under even current work cover legislation requirements. So there's a whole lot of work, I think, that needs to sort of happen with these big sporting industry bodies before Medicare says, no, stuff you, we're not paying for your MRIs and your any other doctor treatment, and work cover also sort of turn a blind eye. I'd hate for these people to be left out in the cold, because especially, I tell you, the number one people who'll be left out in the cold is women, because they get paid almost nothing. They don't have much resources or financial ability to pay for a lot of medical treatment, and they'll be the casualties. If work cover, say, or Medicare says, well, you're a paid professional, and a woman says, well, hang on, I'm only getting 10 grand a year at cricket, and I've stuffed my knee so badly I can't actually work as a tradie. Who's going to pay for the rest of her career? So I think it'd be an interesting space to watch over the next decade to see what happens.
Yeah, most definitely. No, you've answered it really well. And do you feel as though, going back to the AFL situation as well, there's so much talk these days about the consequences of a tackle. Do you think that's something that they could look at as well, rather than actually, at the moment it's focusing on the consequence rather than the actual technique of the tackle? Do you think that needs to change as well?
I don't know is the short answer.
Yeah.
Because there are some tackles that look dangerous and people walk away from, and people and tackles that are fairly innocuous and get called up as a free, and people can get injured from them. The problem with banning tackles or looking at this stuff is that people's ability to absorb shock differ. You've got the old glass jaw people who really don't need hardly a bang and they got a bit of a headache and they don't feel well, to people who can get absolutely smashed and they're fine, they bounce up off the ground. The gridiron sort of guys years ago were putting impact sensors in helmets to see how much force was needed to create some of these concussions. And they talk about gravities, so we're walking on a one gravity planet. If you're a fighter pilot turning a corner, there's like 5 Gs or 6 Gs pulling on you. So the G force on your head can vary between about 5 Gs and 50 Gs on different people to create these head injuries and concussions. So I get it. They're trying to ban these tackles that sort of could cause the potential for it. But I think it's a very difficult area to navigate. And again, you're seeing a discrepancy between AFL, SANFL, and community sport. I've got a lot of patients who just, middle-aged blokes living vicariously through their kids, playing community sport. And they're saying they actually prefer watching a lot of more amateur games because to them it looks rougher and tougher and what they remember of the 1980s, so it's not as well policed. So, there's hopefully some trickle-down effect of umpire training and coaches' education about how to tackle in a safer way. But I think it's a difficult area, and I don't think there's a right answer, unfortunately, Bevo.
Yeah, it's really tough. I actually feel for the umpires a bit because they cop it so much, and we're hearing all the time that the umpiring is the worst I've ever seen it, even though Andrew Dillon said the opposite the other day. But of course, he's going to say that. But I think it must be really tough as well for umpires because they change the rules so much. And I get that they've got to focus on the head and with head knocks and sling tackles and what have you. But it must be a really hard game to umpire as well, and it's getting faster and faster.
Yeah, I have friends who've umpired in the country, and I know it's hard. They obviously have umpires meetings sort of through the year, but the man or woman at one end's got to see what the man or woman at the other end umpiring is like, and then there's the man and woman in the middle, and they've all got to sort of try and have some consistency across a game. Again, you're talking to a Kiwi, and there's one ref, blowing up a game at rugby, so it seems a bit crazy having 3 people running around, but. It's a fast-paced, big oval, so I get the need for 3 umpires, but it is a very, very tough job. We don't have enough umpires. That's the problem in community sport. We need, the AFL's tough, but the umpires do get paid well. They get backed up. They've got spokespeople, but the teenagers and women and men sort of umpiring during the day or during a Saturday and Sunday, they're the people I think you got to feel for, and we've got to encourage people to be supportive of umpires, and as a general thing, just bite your tongue. If you're at a Saturday game, it might feel like they're cheating and all that sort of stuff, but they're doing the best they can. So try and be supportive of them. But we all got our opinion. That's part of the great thing about sports and talkback radio, isn't it? Like one person can. Yeah, I want to design. I want to read. I'm going to write this book, Bevo, and hopefully you'll buy it. So on one page is my team's losing, and this is what you say. And the other page is my team's winning. So you're running through the middle, you're handballing like mad, and your team's losing. So Bevo, the commentator, says the handballs were overused, they weren't looking up, and they weren't kicking along. Awful. And then the other guys are there, now they're winning. Clever use, a slick use of handballs. Geez, they're skilled, and they can run past their opposition. So the umpiring is the same, of course. If you've got 2 big teams at the MCG, you got half the ground boos and half the ground says yay, and then the opposite are doing 2 seconds later. So we've got to realise it depends on who's winning on the day. If your team's winning, you think the umpires are great, but I take my hat off to them. We need more community umpires, so keep up the good work, community umpires. Well
said. It's a tough gig for sure. I've been a basketball umpire for over 10 years myself back in the day, and yeah, you cop a lot, so I know exactly what you're saying there, Ralfey. I want to ask you another question as well. A friend of mine who's a doctor from the Riverland, and he's noticing a lot of people over the age of 50 actually having ACL injuries. Is that something you've noticed, and what do you think the cause of that would be?
What I notice on a Saturday is half the room's filled up with older netballers and footballers all filling in because the B grade, 18-year-old son or daughter's netball or football team needs someone. So, they turn up, lace the boots up, and away they go. I had a friend, she was sort of 43, just filling in down south for her netball team, and she's pretty fit. And they thought, oh, you'd go up in the grades, and she just ripped every ligament you can imagine in the ankle. So, we know that if you're well conditioned, they do these neuromuscular activation exercises. The FIFA 11 plus exercises, what the soccer guys do. There's an AFL version and a netball version. Those sort of exercises and keeping fit are all helpful for preventing these injuries. I haven't seen too many over 50s with ACL injuries, but you bring up like no more than anyone else. We mainly see the young ones coming through. If you're older and you get a sore knee that's a bit swollen, quite often, a week later with a bit of Nurofen, it's sort of behaving, and because there's no way you're going back to play footy, you're just doing your accounting work and you're getting up and down from your desk, your knee's not going to trouble you too much. So you can get these delayed presentations. But if you could explain something to me, Bevo, I'd be very happy, because once you turn 50, the government will not subsidise an MRI for your knee. So maybe this is what the doctor's implying. So, if you're 50 and 1 month of age, and you turn around to, chat to someone and your knee goes bang, or you're playing footy, or you're trying to keep fit running and the dog's pulled one way and your knee goes bang, you can't get an MRI subsidised MRI. So instead of paying $100 and something, all of a sudden you're up for $300 to $400. I'm a sports GP. I'm not a specialist, so I get MRI rebatable. The only thing I can get MRI rebatable in the limbs is a knee if you're under 50. I don't know what the government expect us to do if we're over 50, to sit on the couch and whinge to the wife or our partners. But so I think access to getting good scans is important, and they should bring back the rebates for these things.
I totally agree with you.
Happy to see any 50-year-olds.
I absolutely agree. And in terms of the younger ones, and I mean, even talking about the AFL again this year, I think Brisbane Lions have had 5 players or something do ACLs this year, and we've seen our very own Sam Powell-Pepper that's done an ACL as well. And it seems to be a case of there's a lot more common ACLs these days in AFL and AFLW in particular as well. Like, is that something you've noticed?
Yeah, I mean, we've known that women have sort of a higher rates of ACLs for a long time, and estimates vary between 4 to 6 times. And sometimes you can point to anatomical factors, and there's, notches in the bone and the angles of the leg and how people land and stuff. But it's $1 million question. What's interesting is ACL injuries fit under the soft tissue injury umbrella. So it's not a fractured bone, it's a soft tissue, it's an ACL, it's a ligament. One of the big questions over these things is the psychological effects of stress and worry and on soft tissue injuries. There's a huge soccer study when they looked at over 70 professional soccer teams by a Swedish orthopedics professor, and the only thing that correlated to soft tissue injuries was stress and worry. So when the international, continental soccer teams and the UK ones now sort of do these wellness markers. The AFL do it as well, and you'll be feeding back every day or every couple of days about how you're feeling, how you're sleeping, your stress and worry levels, and it's highly correlated. And Jen, being in that area, sees it too with soft tissue injuries. As soon as people get stressed, worried, lack of sleep, footy's not going well, having trouble with the coach, any sort of life stress can put up your risk of these sorts of things. So, of course, I'm not saying that's the case with all these ACL injuries, but it's part of the X factor. And I've almost got to the point now, every time someone does a hamstring or hurts their back, and then I sort of lean back and try to put my psychiatry hat on and says, so, how's life? and a number of times, like people said, oh, my job's no good, or mortgage repayments are getting me, or there's something that's happening in their life that's tough. It is quite astonishing, and that's been backed up in the research. So I'm hoping that the psychological environment around these guys is good, just as good as all their physical environment. And it's traditionally the ACLs are sort of done at the start of the year when you got these hard grounds. So seeing them sort of happen through the year is a bit of a mystery. But they're running harder and faster, training longer. So I'm all ears. We're always keeping our eyes open for new research to say why.
So, Ralfey, I've got a really good question from our producer, Rory, and he's asked, have you ever come across a situation where you've called a career-ending injury and it's actually been okay and they've been right to go back the next week?
Not yet. By the grace of God, like I think most of my work is actually the opposite. Quite often they'll see orthopedic surgeons or other people telling them, and by them, I'm not particularly talking about elite level players, but just community players and people who just want to keep fit. Orthopedic surgeons in particular are very good at telling people, don't exercise, just take it easy, just you might be able to walk the dog and do nothing else. And you can see people's faces just fall in a heap as they're describing this conversation with the orthopedic surgeon. Now, to be fair, the orthopod, if he's given someone a new knee replacement or a hip replacement or done an ACL on them, they want them to be well and not come back for more surgery because it is a hassle, getting these revisions and things done. But, like I tell the patients, what we don't tell the orthopedic surgeon, he or she doesn't need to worry about. I was operating with one of the knee surgeons, a while ago, and I think he'd operated on everyone's knee in the operating theatre, all the nurses, my knee, the anaesthetist knee. And he told everyone not to run, and guess what we did? We all ran, and we were all having a great time. So he was just rolling his eyes and huffing and puffing. But, that's what you do. Now, I think my role is to give hope. It's to find out ways that they can get back to sport, even if it's in a modified way, and because at the end of the day, like what we've all got to do, what have the scientists said? We've got to smile, exercise, be with your mates and, and keep exercising. And that's what sports does, in spades, gets you back around your mates, you have a good time. So, yeah, if you do have an awful knee injury, you may not be a midfielder sort of getting 30 possessions anymore, but how can we get you back playing sport and enjoying it? So, to be honest, I've got to really take my hat off to my wife, because being a PE teacher and elite level coach in many different sports, she's got so many different ideas about how people can not be as simple as get back into golf or get back into tennis, or what are some training exercises they can do that start waking the body up and giving them some confidence to get back into their chosen sport. I only had a young woman today who was having trouble training at soccer and being worried about headers. And as I was coming back, Jen had 5 different training exercises, she could do to, and their coach, their club coach didn't have any ideas, just said, oh, you got to do it on Saturday sort of thing. So, giving people ideas, being their life vest of hope, as being one thing that said, these sorts of conversations is my job. Yes, I will call it. There are some injuries. There's like navicular stress fractures, they're hard to come back from. Sometimes ACL injuries, they can end someone's career. But, luckily I haven't made that call yet.
Good one. Do sports doctors have pretty hectic nightmares, Ralfey? Another good question from Rory.
Not really. I think it's, in some ways, you try and avoid that. I mean, the serious side of that question is there's a lot of actually mental health issues in doctors. We've got 2 to 4 times the rate of suicide than the general population. There's a lot of stress and depression. If you look at income protection figures for medical people, the number one reason they pay out is actually depression and anxiety disorders, and doctors that are so bad that they can't get back to work. So actually bringing your work home and being stressed and worried, and to the point, yes, you are having nightmares about it, is an issue for a lot of doctors. So in some ways, it's a bit like you try and avoid that by doing what a good sports person would do. You try and be prepared. You do your background reading. When someone comes into the room, I read about them. I try and track down imaging. I can probably sleep pretty well at night because I think I send them on to people if they need to be pretty good people, pretty good therapists, physiotherapists, orthopedic surgeons who I trust. So, yeah, there can be people who have pain that you can't explain. But I think we're very lucky in Australia because we have referral pathways and specialists who are very good at what they do. The sort of nightmares in a way, and, this is the annoying thing, is the nightmares are the people who go drinking. You've just done your ACL or fixed their patella because it keeps dislocating, And next thing you know, they're telling you about that night. They're on top of the table. I kid you not. This is, like my room's great. It's like the confessional. People just say what they want, and I'm not judgy. I just look bewildered. They're saying they're on top of a table. They've had a few drinks, and turn around because what could go wrong? And their kneecap pops out again. That's come out 5 times, and the surgeon spent 2 hours putting back together. So those sorts of things are quite frustrating. But it's part of the game, and it's part of the education process for these young ones about looking after themselves. Some of those conversations with younger people who think that they can, get through an injury by drinking and dancing their way out of it. Often on Sunday is an amazing time because that's when all the country people come in, and often the lads and the ladettes, they'll be propping up a bar all night, having a couple of cold ones, and they come in the next day and their knees as big as a pumpkin, and you say, what the hell happened? And, they've been drinking and standing on it all night. So those are the sorts of things that you just cross your fingers and hope they go well. But they're my only nightmares. So I sleep pretty well. Like I said, I've got a good life and a good wife. It's going all right.
I've done that with footy before and rolled an ankle and then gone out drinking that night. And then, like you said, the next day, it just absolutely blows up. So I've been very guilty of doing that, Ralfey.
You're not alone, Bevo.
Which actual patient that you've dealt with has left you starstruck, and why? Like, who have you actually looked after and thought, oh, this is just absolutely amazing? Like, obviously not Michael Jordan. You wish, but like someone.
How would you know? Well, this is the problem in medicine of any type. Probably anyone who treats famous people, because you can't say who you've treated, because there's a law about it. Yeah. And you get about $500,000 fine if you actually say something. But B, you're in a hiding to nothing. So if it works well and they get back to the sports ground or whatever, and it works, well, that's great. No one says anything. And if it all falls in a heap and something goes wrong, you make a bad call, everyone knows about it. So, dealing with sort of the more famous type people, it can be tricky. To be honest, one of the more people I'm enjoying seeing at the moment, my daughter is a production assistant currently working on a movie, and every now and then they need a doctor. So you get patients who'll come in who are famous actors or actresses, and they need a medical or they're a bit unwell. So I have been starstruck from seeing those sorts of people, and particularly visiting people who might be Cirque du Soleil, or they might be doing some musical and they're a well-known person. And actually they're fascinating people to deal with, because every night's a grand final for these people. They have to tap dance, they have to jump on a pole and swing around 3 times and all this sort of crazy stuff. And you're trying to sort of manage their injury, and you say, well, you got a foot injury, you can't jump up there and do this or do that. And he said, but I'm on a pole and I'm leaning this way and I'm having a sing at the same time. And you're going, oh my Lord. No wonder it's tough to teach you. So I love treating people like that, and I have enjoyed meeting a lot of very nice people. So starstruck by every patient. Every patient's important, and I enjoy them all, to be honest. I mean, everyone's got stories. I love talking to older people, and they've got so many stories, and some of them are incredibly famous and in their own right and in their own time. I mean, the guy, I think he's passed away now, so I could mention, I can't remember his name, but he invented Beyond Horizon Radar. You get some amazing people who have done some things in their life. So I really enjoy meeting everyone, to be honest, Bevo.
No, you've answered it beautifully, Ralfey. Well, and thank you so much for answering all my hard-hitting questions as well, and being a wonderful guest today on Legends with Bevo.
Thank you very much, Bevo. Enjoyed it immensely. Thank you so much.